Have you been curious about alternative medicine, things like acupuncture or Tai Chi? Then stay with us for Doctor on Call. Good evening. I'm Susan Collier and welcome to Doctor on Call. Tonight we'll be talking about alternative medicine. We'll take you to an acupuncture procedure and a Tai Chi class. Alternative medicine is becoming more accepted in the United States, so much so that the Journal of the American Medical Association devoted an entire issue to the topic. Joining me for our discussion is Dr. Kenneth Carter, a psychiatrist with Rock Hill Psychiatric Consultants, and we'd like to welcome you to the program, Dr. Carter.
Hi, Susan. Thanks.
And I'd like to invite you to join our discussion tonight by calling 803-324-3184 with your questions this evening. And Dr. Carter, what I'd like to start out with this evening, if you could you define for us exactly what alternative medicine is?
Yeah, alternative medicine is a general term for a wide range of therapies, things ranging from acupuncture and Tai Chi to herbal medicine, to various hands-on types of healing, and hands-off like Reiki and massage. So it's really a very broad term, and what it implies is those therapies that have not traditionally been taught in American medical schools.
Now, when I was doing some research for the program, I ran across terms like alternative and complementary. Can those be used interchangeably if we see that? Is alternative and complementary medicine basically the same thing?
Well, they are, but the names imply a different emphasis. Complementary implies that the alternative medicines are seen as being used with Western medicine in a well thought out and reasoned fashion. Alternative implies an alternative to Western medicine, and both concepts have a place. Complementary kind of implies that you're working together more as complements coming from different directions to approach a problem, whereas alternative implies that you're stepping out of one box into another one.
Okay, yeah. And that's the other term then that I ran across to kind of clarify all the different terms we're seeing out there is integrative medicine.
Yeah.
And where does that fall into the realm of definitions with alternative and complementary if you talk about integrative medicine?
Again, I think it's a question of emphasis, and with integrative, it implies that there's more of a communication between a traditional Western practitioner and that of an alternative therapist. For instance, in my practice, we try to really integrate the acupuncture, and I have an herbalist that I often refer persons to, but we communicate very closely about what's happening with the patient so that it's really integrated into every aspect of the patient's care. Complementary might imply that I refer them, that they're getting treatments that are alternative, but the communication between the two different providers might not be as close.
Okay, so, and we have a telephone call.
Okay.
Go ahead with your call, Wanda. You're on the line.
Okay, I have a problem. I am addicted to cigarettes, and I know I need to quit, but I guess I'm too weak. I'm addicted to them. And I guess a lot of people have this problem, but I don't know how to fix it.
Okay. Dr. Carter, is there something that Wanda can do to help with smoking cessation in this arena of alternative medicine?
Yeah, Wanda's question is a really good one because it allows us to focus on the range from alternative to complementary to integrative. From an alternative perspective, she could certainly try acupuncture, and there's a specific acupuncture technique that we found a measure of success with cigarette smoking. There are also some herbal preparations that help with nicotine craving and with the withdrawal symptoms. From a integrative perspective, however, there are medications that can help with cigarette craving as well, like Zyban. People may be familiar with that. We actually have a smoking cessation clinic at Piedmont Medical Center, and in my own office we tend to combine things. So if she came to see me or someone at Piedmont that I've been instrumental in training to use some of these therapies, she may be recommended to receive the acupuncture and an herbal preparation and some hypnosis work or mindfulness work, as well as some Zyban. So we can go across the whole range of things. The other thing is that the 12-step community is certainly very important and has was instrumental in teaching the medical profession when we weren't really interested in treating addiction that much. That we need to be concerned with people, places, and things. So the traditional approach to addiction treatment would also apply to cigarette smoking cessation.
So there's several avenues that she could
There's
take.
a lot of different avenues, and the choices often depend on what the patient wants, what Wanda would want for herself, and from her own particular value system and perspective. So.
Okay. And acupuncture was brought up, and you are not only a board-certified psychiatrist, and that's board-certified with the American Medical Association, you are also a board-certified acupuncturist. Is that correct?
Yes, that's right.
And that certification comes through?
There's a just like the physicians have a national board certifying body that's sanctioned by the AMA, the acupuncturists also have a national body, the National Commission for the Certification of Acupuncture and Oriental Medicine. And most states that recognize acupuncturists these days, including South Carolina, require that certification by the NCCAOM.
What exactly is acupuncture? I mean, we all have the vision of, and my vision of, it's sticking needles in a person. What exactly is acupuncture?
Well, it's a way of treating the surface of the body and affecting internal change. And sometimes those responses can be really profound. I mean, I've been practicing acupuncture now for over 10 years, and I'm still amazed at some of the responses that I get. But at bottom, it's taking a needle, a very thin filamentous needle, and inserting it into predetermined places on the surface of the body that can affect internal change. The changes that can be affected can involve everything from craving, for instance, what Wanda is struggling with in terms of her cigarette smoking, to managing stress, which is something that Wanda might be struggling with that might make her reach for a cigarette in terms of helping to manage that, to chronic pain and acute pain symptoms. It's been used a lot for especially lower back pain, neck and shoulder pain and injury, sinus problems, premenstrual and perimenopausal problems, a whole range of things.
Okay. Well, I had the opportunity to visit Dr. Carter's office last week where he performed an acupuncture procedure on me, and we're going to share that with you, and let's take a look at that tape right now.
What I'm going to do for you today is a simple 5-point technique that can help you feel more comfortable, and it's very predictable in doing that. It does not require a diagnosis, and you'll tell us how you feel after half an hour or so.
Okay.
Okay?
All right, let's get started. Good. It's not going to hurt.
Well, the most that you should feel is like a mosquito bite. Most of the points you won't feel going in at all. And but some people do have a little bit of sensitivity. The reason why it really doesn't hurt, any more than a mosquito bite is because it's not a hypodermic needle. The needles are very, very thin, and I'll show you one of the needles before we get started.
Okay. Oh, it is tiny.
Would you like to hold it? And it's red, so it's going to match your coat too.
Cool. Okay. All right, I think I'm ready.
Okay. Take a deep breath in and breathe out.
Open to that.
Deep breath in, breathe out. Okay, same thing. One more time. Okay, that's it. Now we're going to let you relax for about a half an hour, and I'll come back and take them out for you.
Okay.
Okay, good.
Great.
So, how you doing?
Good.
Yeah?
Yeah, that was nice.
Good, good, good.
I want to share with you that, I don't know about you viewers, but I was wincing as I was watching the needles go in, but I want to let you know that it really doesn't hurt, and what Dr. Carter said is true. It doesn't, in fact, it's not even as bad as a mosquito bite, I don't think. When I had gone in for that, I was somewhat stressed, as Dr. Carter can probably attest to, and a little bit nervous about the procedure, but came away from it feeling very, very relaxed. but I didn't feel sleepy, and I was surprised at that. And the other thing, I was talking with Dr. Carter before we went to air tonight, was that I had probably slept better that night than I have in a long time. And in the morning, I woke up and I felt more focused and centered. And was wondering if that's pretty typical responses to this particular acupuncture procedure that we just watched.
It is. I mean, it's interesting that the more unbalanced you are, the more stressed out you're feeling, the more dramatic the effect seems to be. But improvement in sleep and just feeling more centered is a very common response.
Does that indicate then I was probably feeling pretty stressed out when I came in there?
Yeah. I mean, but the stress that most of us feel after a day at work, or and that's probably one of the most benign examples,
Right.
Because stress comes in many forms. I mean, it can come in terms of environmental stress, like at work, or physiologic stress, like if you're trying to break a habit, whether it's a habit of eating or gambling or drinking or smoking or hard drugs. And the body's response to stress can be affected very profoundly by that simple 5-point technique. And we feel very fortunate at Piedmont Medical Center. We have about 20 individuals that are trained now to perform that for people. And it's so simple to do. I mean, so it doesn't really require diagnosis. It's very accessible, and
Okay.
most people really enjoy it.
Okay,
So,
and we'll talk
yeah.
a little bit more about that in a second. But first, we've got a caller from Tega K. Barbara, you're on the line. Go ahead with your question, please.
Yeah, I'd like to know whether or not there are any alternative method procedures that would help arthritis. First being arthritis of the hands, and then arthritis of the knees, where there is very little cartilage left, almost bone on bone. Is there anything in alternative medicine that would help that?
Yes, the acupuncture can reliably give you relief from the pain symptoms. In terms of the cartilage with bone on bone, acupuncture is not at all to be expected to replace the cartilage. And so I would encourage you to consider it from a complementary perspective. And I like to say and instead of or. So the acupuncture could certainly give you some relief from the pain that you're experiencing, but you probably need more than that. There are a number of diets that have been developed to address the problem of arthritis. There are, again, some herbal interventions that can be available to you. I hesitate to recommend anything specifically since I haven't talked to you in any great detail, but the short answer is that yes, there are some alternatives available.
Okay, and we have another call, Dr. Carter.
Okay.
Meg from Van Wyck is on the line. Go ahead with your question, please, Meg.
Yes, good evening. I'm a first-time watcher, and I'm glad I tuned in.
Oh, thanks for joining
Dr.
us.
Carter, I'm a struggling diabetic, struggling with exercise and nutrition and controlling blood sugar. Do you have a procedure that would help?
Yeah, one of the most difficult things about diabetes is that, and I'm assuming yours is an adult onset diabetes, is that we grow up being used to certain habits. And to try to change them midstream, when someone says, don't eat grandma's, coconut supreme cake anymore, or that you come home and you have to think of another way of rewarding yourself in terms of desserts and that kind of thing. It's just like trying to break a habit that you've been ingrained to follow. It's like being in a groove, and you have to somehow manage to carve out another direction for yourself. The acupuncture can help with that kind of habit change. And again, there are other alternative medicines that can help with that as well. Also, there are, it may mean that you need to learn how to cook in a different way. It's interesting that from an Oriental medical perspective, herbs are looked at as food. They're not classified separately as medicines, but are looked at as food. And it's all part of one grand medical scheme that could help you get back on your feet as far as getting your blood sugars under control with the diabetes.
Okay, and I think we've got another caller on the line. Dr. Carter, go ahead with your question, please. You're on the air.
My name is Sybil Cato from Lando, South Carolina.
I'm sorry, Sybil?
Yes?
Okay, good evening.
Okay, I have emphysema, asthma, COPD, and fibromyalgia, and have a lot of chronic pain. Would this acupuncture help this?